Yes, hello everyone. Today we are doing the dissection of suboccipital triangle. Suboccipital region is on the back of the neck, and as we reflect the skin, we see the first layer of muscles of the back. This is trapezius muscle. We have cut open the trapezius muscle, and underneath we can see attached to the scapula, on the medial border of the scapula, are the rhomboidus muscles. These are the rhomboidus muscles. We are going to dissect out the suboccipital triangle in this region. So when we identify trapezius, then we go on reflecting the deeper back muscles. This is Splenius Capitis. Splenius Capitis, look at the direction of the fibers, and it is attached to the upper thoracic vertebrae, and superiorly it is attached to the mastoid process and lateral part of the superior knuckle line under the cover of sternocleidomastoid. So this is sternocleidomastoid and this is Splenius Capitis. We reflected Splenius Capitis also, and then the muscles which we observe. One more thing I want to tell you, that here we also observe the levator scapulae muscle. You can see that this is the superior angle of the scapula, this, and this is the levator scapulae muscle arising, having an attachment here at the superior angle of the scapula, levator scapulae muscle. We reflect Splenius Capitis now, and we identify the muscles which lie underneath. Here, this muscle which you see, this straight muscle in the midline, coming from under the rhomboidus major and going for its attachment to the caput. This is Semi-Spinal Escapitis. Semi-Spinal Escapitis is the muscle responsible for making the elevated area by the side of the groove at the back of your neck. This is Semi-Spinal Escapitis. The fibers are directed straight upwards. By the side of Semi-Spinal Escapitis, we see another very slender muscle similar to the direction of the fibers of Semi-Spinal Escapitis, and this is Longissimus Capitis, again attached to the caput. We reflect these two muscles also inferiorly so that we can clear up the area of suboccipital triangle. And as we reflect these muscles, we see very clearly the muscles which form the suboccipital triangle. This is Rectus Capitis Posterior Major. This is a little oblique, although it arises inferior to the inferior knuckle line. More medial to it is Rectus Capitis Posterior Minor, although not participating in the boundaries of suboccipital triangle, but we must identify this muscle too. So Rectus Capitis Posterior Major is forming the boundary on the medial aspect. Superolaterally, the suboccipital triangle is formed by superior oblique muscle. Inferolaterally, it is formed by inferior oblique muscle. This muscle is inferior oblique muscle. Here I really want to tell you that sometimes what happens is that as we reflect Semi-Spinal Escapitis, we take the fibers of superior oblique within this muscle. So we should be very careful when we are reflecting the Semi-Spinal Escapitis downwards. Another method is that you can find the inferior oblique muscle, trace it, and then you can trace the rest of the two muscles, because there is a high risk of reflecting the fibers of superior oblique as well as the Rectus Capitis Posterior Major when we reflect these muscles of the caput, that is Semi-Spinal Escapitis and Longissimus Capitis. Alright, and here this is the triangle, suboccipital triangle. Another important thing I want to take your attention to is the thickest cutaneous nerve here, which you find winding around the inferior border of inferior oblique. This is the greater occipital nerve. It is seen piercing this muscle, Semi-Spinal Escapitis. It pierces two muscles. It pierces Semi-Spinal Escapitis, and further superiorly it pierces trapezius muscle, to be seen in the occipital region as the thickest cutaneous nerve. So this is the greater occipital nerve. Here I want to take your attention to an important content of the suboccipital triangle, and that is the vertebral artery. I am holding it and I am moving it. This is the vertebral artery. The venous plexus which you see is the vertebral venous plexus. I have cleared it off so that we can appreciate the white luminous artery here. Also, we can appreciate the arch, but rather seen it is more felt. As you beat it, you get a bony sound, right? So as you do the dissection. Also, between the vertebral artery and the posterior arch of atlas vertebra, we find the suboccipital nerve, but somehow that got cut in this dissection. But this is how we do the dissection of suboccipital triangle. Thank you.